far from where the hurricane is entering in southwest Florida, and those warnings will likely to continue until this finally leaves our state. So even if you're not in the direct path of the storm, you need to take all tornado warnings seriously, and you need to take appropriate precautions if that is happening in your area. The Florida Department of Transportation has just announced that Fort Drum, Canoe Creek, and Turkey Lake service plazas on Florida Turnpike are now closed. Obviously, they will try to get those open as soon as they can. We have 200,000 power outages reported throughout the state of Florida, but outside of southwest Florida, crews are working to quickly restore power. Of course, 200,000 is a drop in the bucket for what's going to happen over the next 24 to 48 hours. There's going to be widespread power outages, particularly in southwest Florida. We have over 100 portable cell towers ready to be deployed into the area once it is safe to enter. Once the storm is past and it is safe to go outside, you still need to be cautious. Avoid downed power lines, standing water. Stay clear of downed trees, and don't drive in standing water. And please, if you're going to use a generator for your home, do not allow that to be inside. The exhaust needs to be outdoors. Stay out of the way of emergency crews, out of flood waters, and away from all downed power lines. Stay off the roads. There's no need to rush back. You're going to have a massive surge of people that are going to be going in to provide, of course, life safety assistance for those who may have stayed in some of the more hazardous areas. You're also going to have power workers going in. We were just in Lake City. I was thinking we had all these power workers, these line workers from all these different states. I saw them from Texas, Louisiana, all these different places stage. We have a massive, massive mobilization. Their job is to get in there and help to restore services. You're also going to have folks bringing in things like food and water. So there's no need to rush back in. There's going to be a lot going on in the immediate aftermath, and a lot of people's safety depends on that. If you're on the roads, you're putting yourself in danger and limiting the ability of emergency crews to restore power and clean debris. Now, we don't know how much debris is going to be, but there's going to be debris, and that's going to make it very difficult to navigate some of these roads. That's why FDOT's immediate mission is to clear the roadways so that people are able to go in and access that to be able to help deliver services for people. In 2019, we were projected to be hit by Hurricane Dorian, which was a Category 5 storm. Fortunately, at the last minute, it took a northward turn and missed the coast, but we did have a really massive mobilization. This mobilization's exceeded that. This is a really, really significant effort, county level, state level, federal support. It's really been impressive to see. Director Guthrie has asked for additional airlift, hoists, and high water vehicles from DOD in coordination with FEMA. The Secretary of Defense has approved Florida's request for dual status of our National Guard forces under Title X to provide additional forces, which we very much appreciate. We will also be submitting momentarily a major disaster declaration for all 67 counties, and we'll request that the federal government reimburse 100% of the upfront costs for the first 60 days to ensure that we can quickly recover and move forward into the response and recovery part. And if you think about this storm, we had storms that have been as strong as this hit Florida? Michael, Hurricane Andrew, Labor Day hurricane many, many decades ago. Yes. Have we had big storms that left a lot of water and flooding? We had Irma recently. This is really bringing both to the table. I mean, you're going to have massive amount of power hitting that coastline with really, really strong winds. That is going to do a lot of wind damage, but you also have the storm is so massive, and people are kind of comparing this to the track that Charlie took in 2004, because Charlie was like this, was expected to hit Tampa Bay. It turned and ended up hitting Southwest Florida. Charlie was strong, but it was a fraction of the size of what we're dealing with here with Hurricane Ian. So the effects of this are going to be broad, and we appreciate the Biden administration's consideration for the people of Florida during this time of need. When I was in Lake City, you had massive numbers of linemen, but you have those staged all over the state. There's now over 42,000 linemen and other personnel ready to restore power in 30 different areas across the state. And those linemen and other associated personnel hail from, of course, many from Florida, but from 27 different states. Of course, our Department of Transportation does have 1,200 personnel on standby to perform cut and toss operations, understanding how important it is to get those roadways clear as soon as possible. Supplies will be brought in by plane, boat, and by high water vehicle. Airports in Southwest Florida do have teams behind, and they are going to work to clear those runways as soon as the storm has passed. We appreciate the Florida National Guard's really impressive mobilization of over 5,000 folks, as well as 2,000 additional guardsmen from other states. They have 9 Chinook helicopters ready to go. An additional 22 helicopters will be coming in after landfall that will be here within the next 24 hours. Kevin will talk a little bit more about this, but we have the 5 urban search and rescue teams. You'll hear from FWC about what they're doing, high water vehicles from Florida Highway Patrol, and of course our Coast Guard partners. There is going to be a massive effort as soon as it passes Southwest Florida to be able to get out, recon the area, and identify areas where there may be a need of rescue services. And some of these counties obviously know where residents decided to hunker down in, so they're going to be looking there first. But this is going to be really, really important to be able to get, I think in Hurricane Michael, I mean, it took a few days to be able to get into Mexico Beach. We have the air assets to be able to recon and know where the response efforts need to go. And so in total, we have nearly 250 aircraft, more than 1,600 high water vehicles, and more than 300 boats of all drafts and sizes, including 250 already in the major impacted areas and nearly 50 that are staged and ready to come in as needed. These include smaller rescue-oriented boats, airboats, and larger boats that will be delivering supplies by water if need be. I want to thank the 26 states that have sent us support, including Tennessee, Virginia, Montana, New York, Colorado, Indiana, New Jersey, and Georgia. I just spoke with Kay Ivey from Alabama, and she's supporting sending some Black Hawk helicopters down to help. Governor Bill Lee in Tennessee fast-tracked a request that we had from Tennessee. We appreciate that. I was also able to speak with John Bell Edwards from Louisiana. They've helped us. We said, hey, we've got a lot of experience in hurricanes recently, so these guys are good. Ask us. We want to send more. And so we really appreciate that consideration, and if we need that, we certainly will do that. We also understand that people that are displaced are going to need assistance, so the Department of Economic Opportunity has already deployed funding and guidance through community action agencies to help Floridians in need of short-term support like utilities, hotel bills, and transportation if they have been displaced by this storm. Please continue to monitor local reports, weather reports. Be very cautious about going out into hazardous conditions, and then once the storm passes your area, just make sure that you're very careful, because there's going to be a lot of things, a lot of hazards that are going to be down on the ground. I know there's a lot of people that have reached out. First of all, I want to say thanks. A lot of people have offered thoughts and prayers for the folks that are in the eye of this storm, and that means a lot to us. There's also people that want to be able to do their part, and so I've directed Volunteer Florida to activate the Florida Disaster Fund, where people can donate. It's much better to donate financially rather than sending items. We have everything we need in terms of the immediate response needs, but there will be thousands of Floridians who will need help rebuilding. And to contribute to the disaster fund, you can visit www.floridadisasterfund.org or text disaster to 20222. Again, that's text disaster to 20222. For those who want to come volunteer, we have an official volunteer portal at Volunteer Florida, and that's at www.volunteerflorida.org, www.volunteerflorida.org, and you can look to see of the volunteer opportunities. This is going to be a rough patch here for the rest of today and into tomorrow. But we understand how significant this storm is. Yes, there'll be an immediate response. Yes, there will be things that happen with recovery. Eventually, there won't be much media attention on this as the weeks and months go on. But we understand a storm of this magnitude is going to require an effort over an extended period of time. Those are good folks down in Southwest Florida. They've got really great, thriving communities. This is not anything anyone wants to deal with. It's not something we certainly ask for, but we're going to step up. We're going to be there for folks, and we're going to make sure that folks get back on their feet, and Southwest Florida comes back better than ever. Okay, Kevin Guthrie.
Thank you, Governor. As the Governor has said, Hurricane Ian is approaching landfall as a Category 4 storm with winds of 155 miles per hour in Lee and Charlotte counties. At this time, the division has received nearly 1,000 resource requests from our impacted local partners, and 864 of those are either in process or completed. We are working as quickly as we can to address the needs of those impacted areas. This morning, I talked with each and every local emergency manager in the direct path of the storm. If you are sheltering in place in the path of the storm, we're asking you to now please visit floridadisaster.org/info and fill out our shelter in place survey. Again, that is floridadisaster.org/info to fill out our shelter in place survey. The shelter in place survey is designed to provide critical information to first responders about the demographics of your household so that they can aid your families as soon as possible. This is primarily for those who did not evacuate, so that we know where you're at. This is not a substitute for 911. If you have an immediate need and you need first responder assistance, you need to dial 911. Please understand that those 911 services may not be able to come to you right now, but again, if you need emergency services, dial 911. Even if it is calm outside, you may be in the eye of the storm. I encourage our individuals near Sanibel, near that Fort Myers area, as the eye wall starts to come on shore, if everything stops, the storm is not over. If you can hear us, if you can see us on your TV, you're most likely to have bright, sunshiny area here very soon. You're in the eye of the storm. Stay inside. Stay indoors. Do not go outside. You do not know when that eye wall will collapse. So please stay safe. Avoid down power lines and down trees and standing water when it is over. Use extreme caution. If you see any type of line, do not cut them. Do not cut fiber optic lines. Fiber optics are the backbone of our communication system that allows us to have connectivity for your cellular devices on wireless networks. It provides access to the internet. It provides access to social media. Please do not cut fiber optic lines. To the communities beginning to experience these devastating impacts of Hurricane Ian, know that the state of Florida is standing with you. We have plenty of resources to respond to your need. We have thousands of boats on the ground. We have thousands of boots on the ground. We're ready to assist you. We will make sure that all available resources are used to help you through this difficult time. Please do everything you can right now to stay safe. Thank you, Governor, very much for the opportunity to be here and be your director.
Thank you. All right, Colonel Roger Young, Director of the Division of Law Enforcement, Florida Fish and Wildlife Conservation Commission.
Thank you, Governor. Appreciate it. Thank you, Governor, and thank you, Director, for your leadership and support as always, but especially during these trying times. So on behalf of the FWC, I'm Colonel Roger Young, and know that the men and women of the FWC send our prayers and support to all those in the path of the storm at this time. But also know that the FWC officers across the state are prepared, trained, and ready for a full response to this storm. We have 100 officers outside of the affected area ready to respond with high water vehicles and specialized equipment and vessels. We also have 250 vessels staged already inside the affected area that will be ready and utilized for response to this storm. So just know that we appreciate all the support that we're getting, but officers will be ready to respond in this time. Just want to say thanks to everyone, and the FWC officers will be ready for response. Thank you.
Okay, Agency for Healthcare Administration, we have our Secretary, Simone Marstiller.
Governor, thank you very much for your leadership. Director Guthrie, you as well. Good afternoon. As the eye of Hurricane Ian makes landfall, all healthcare facilities have made the necessary preparations and stand ready for Ian's impact. Since the beginning of the emergency, our agency has been focused on the safety and well-being of residents and patients, and hospitals and long-term care facilities. We've activated the health facility reporting system, and we've requested, and still do request, that all healthcare facilities continue to report their census, their available beds, their evacuation status, and their generator status information. And that includes even facilities that might be outside of the impacted areas, because we need to be sure that we can provide the necessary resources to assist everyone when the time comes for response and recovery. As of today, ACA's teams have coordinated with our licensed healthcare facilities in evacuating more than 7,000 patients and residents from 150 facilities. Additionally, our team has activated the Emergency Patient Lookup System, or E+. This system allows special needs shelters in impacted areas to retrieve patient medical records and help medical providers and emergency response personnel to locate missing or displaced persons after the storm. We also have nearly 400 ambulances, paratransit buses, and support vehicles standing by to respond to the areas of impact. In addition to ACA's team's regular visits to all of our licensed healthcare facilities, we have completed more than 343 additional on-site visits to our nursing homes and assisted living facilities within the cone of expectance to verify generator compliance in response to Hurricane Ian. Today, and I know you've heard the governor say this over the last few days, but 100% of our operating long-term care facilities have generators on site. We've also worked very closely with our partners at the Florida Hospital Association, the Florida Healthcare Association and Leading Age, Florida Senior Living, and the Florida Assisted Living Associations. And we've activated, working with them, the Patient Movement Mission. We know that facilities are currently bracing for impact as Hurricane Ian is anticipated to make landfall here shortly. Following the storm, the Agency for Healthcare Administration stands ready to immediately deploy our surveyors for on-site visits to the impacted facilities. During these visits, we will ensure that each facility is maintaining an appropriate temperature for residents and that all other conditions in those facilities are safe for residents. If you are a patient or resident or family member of someone in one of our long-term care facilities or any other healthcare facility, and you experience any issues during the storm that are related to that facility or your stay there or the service, please know that you can lodge a complaint with the Agency for Healthcare Administration on our website, and that's ahca.myflorida.com, using our online complaint portal. If you are a licensed healthcare provider and experience any issues during the storm, please, of course, notify your local emergency manager, but also please report through our health facility reporting system immediately so that we know exactly what your status is and what we need to do to provide you the resources and help that you need. Moving forward, the agency will continue to require these kinds of status reports for power outages, bed availability, and other needs. This has truly been a collaborative effort, and I and my team appreciate all of the work that our agency partners have been putting in. Thank you, Governor.
Thank you. So as we see power outages accumulate over the next day, 2 days, the crews that are assembled, massive numbers of people, one of the first orders of business, restore power, fuel, all the essentials. Not every power outage is going to be created equal across the state over the next 2 days. When you have a storm coming in at 155 miles an hour, that's not just going to knock down a few power lines. Yeah, it's going to do that, but it also has the potential to really uproot a lot of the infrastructure that makes people connected and that is used to deliver power to people. And so that will just require a reconstruction of that. And that's something that can be done, but it's not as easy as just simply hooking up a down power line back into place. And so as you get more severe wind impacts, more powerful storm, the storm surge, that's where you're in jeopardy of seeing a lot of that infrastructure disrupted in a way that will require more than just simply rehooking it. It's also the case that you may have homes and or businesses that are not going to be able to take the power because of changes to what's happened to their structures. So just keep that in mind. The folks that are staged are mindful of those different things. They want to get in as soon as possible, assess the damage, and help do the restoration efforts. Some of that may just be typical repair, but some of it may be more in the line of reconstruction. So just be prepared for that. I mean, we've been saying that there was going to be, significant power outages with a storm of this magnitude. That's just the reality. So it's going to pass today from Southwest Florida. As soon as it's safe to go in, there's going to be people. I've already talked to a lot of the locals. They know where they need to look to see the damage assessments, to look to see where people may be in harm's way. Obviously, folks at the state level are going to be doing the same thing, and it's important. And we want to make sure, obviously, save people that may need to be rescued, but then get these services started again, because we need to get people back on their feet as soon as possible. Okay, with that, I'll take some questions.
Governor, you mentioned that there were some people that have chosen not to stay, that lived in that were staying in evacuation areas. Do you have any sense?
They chose to stay, you mean?
That chose to stay even though they're in evacuation areas. Do you have any sense as to how many people that is? I know you're doing a survey.
Well, that's voluntary in terms of who wants to participate in that. I just spoke with the Charlotte County Sheriff, which is, of course, going to be probably ground zero for this landfall. And it's their view that the vast majority of people in that Zone A did, in fact, evacuate. Now, they have an island community where they had 31 people that were told, were offered, the transit, and they just said that they wanted to stay and shelter in place. And so I know a lot of those barrier island communities, the counties discontinued services, so they were incentivized to get in maybe a more comfortable environment. But some of those people just made that decision to stay, and they, the local officials were not going to grab them by the shirt collar and drag them out of their own house. And so they did that. And look, we've been saying that if you're in an evacuation zone, once that order is made, you're risking potentially your life by staying. And people did that. Nevertheless, as much as you may disagree with that decision, if there's people in harm's way when this storm passes that need help, we're going to be out there helping folks. I mean, that's just the way we're going to do it. And I know that the folks down there in Charlotte and the surrounding counties feel the same way. And there's a lot of resources that have been brought to bear to do just that. Yep, go ahead.
At this point, Governor, have you heard anything about, and I know it's early, so it's probably too soon to tell, but fatalities, any serious injuries, anything like that associated with this one?
Kevin, I have not gotten a report on that yet.
We did have 2 people transported on the tourism last night.
Question for Secretary Marsteller. Of those 150 facilities, how many were hospitals, and do you have a sense of how many patients within those hospitals that would encompass?
The most recent information that I have, 15 hospitals evacuated, and that amounts to roughly 350 patients. Yep.
It's interesting. Of course, you guys have been following the track. I mean, it was going to be maybe North Florida, then the Tampa. People were talking about one of the worst case scenarios. Of course, it's gone down. My view on that is wherever it hits, if you're in that community, it's probably worst case scenario for you. So I don't necessarily use those. But when it was the Tampa, I spoke with the CEO of Tampa General, and they have a fortification system of their hospital that can withstand like 10, 15 feet of storm surge. And so they do that so that they can keep the patients there, because if you don't have that and you're in a low-lying area, you got to do the evacuations. A number of the hospital systems have done that, who are in those low-lying areas. I think particularly in the Tampa area, I know we had a lot of special needs evacuations, as we should have. I mean, you got to take the information that you have, and they're going to feel effects from this. But my hope is that those patients are going to be able to be brought back as soon as that storm is passed, and I don't anticipate major structural damage. Would be my hope in some of those areas.
So how many individual.
I would do
Okay.
it. Yep.
Sorry, Marilyn. You don't have a take on evacuations for Cape Coral. Just looked on. If you look at the storm surge diagrams that NWS has, it looks like there's a lot of the storm surges in that area. Sanibel and Captiva are getting hammered right now. I'm just wondering how evacuation efforts went there as they embraced the eye.
Again, all of those individuals were under evacuation orders. We don't actually have the numbers of what the percent was that evacuated versus those that didn't. I would imagine, since most of that same area went through Charlie, they probably evacuated. Again, Charlie was a fraction of the size of this particular storm, but I would imagine that most people that have lived through that, they went ahead and evacuated.
I think another issue is just, I mean, there were people that evacuated Tampa Bay to Fort Myers because you see the different weather tracks, and it was thought that it would hit Tampa, maybe go up the coast, and that was not that long ago. I mean, that was, 36, 48 hours ago. You go back another 12, 24 hours from that, it was going to hit Taylor County. And so I think that some of the folks in Southwest Florida, because so much focus was on Tampa, then when it says, oh, actually it may be coming here, I mean, I do think some heeded the warnings, but I think it's because the forecast can kind of be all over the map, that sometimes people say, well, you said it was there, then you said it was there. I think in the future, we tried to stress the uncertainty. When you have a model taking it to Louisiana and another model taking it to Sarasota, and then you just kind of meet, I mean, it's not probably the ideal situation. Now that we're close, once you're within 72, certainly 48, I mean, those are very accurate forecasts. But before that, I mean, there's just so much uncertainty. But I think sometimes people think, well, you said it was going to be here, and then now you're saying it's going to be here. So we'll see how it goes. I know the folks in Lee County, once that forecast changed, I know they acted very quickly, as they should have. And I know that they provided people with an ample opportunity to be able to evacuate. I do think some heeded it, some did not and chose to hunker down. And hopefully, the people that made that choice, that it works out favorably for them.
Issues are going to be specifically for the Tampa Bay area when it comes to rescue efforts from the state. What do you think the biggest issues
In the Tampa Bay area for rescue? Well, I mean, obviously we have enough assets and we understand that this is a big impact, that the rescue efforts are not going to be limited to one municipality or one county. I mean, you're going to potentially have more. My hope is that you're not going to need massive rescue efforts the further away you are from the storm. I also have a huge amount of confidence in the folks in the Tampa Bay area. You look at the sheriff's departments, these are very first-rate operations. They have excellent ability to respond to that. Kevin will be here. Our folks will be here if needed, but our sense is that the further away from the storm, probably the local responders are going to be able to handle that. Here in Southwest Florida, you're going to have all those local responders out, but then you're also going to have all this support, Coast Guard, FWC, you're going to have National Guard. I mean, this is a really, really concerted effort, and that's just the reality when you have such a significant impacted spot. So hopefully they don't need us to fleet resources up. We will do it if there is really significant. But you look at the guys they got up there: Hillsborough, Pinellas, Pasco, Manatee. I mean, those are really, really professional operations. Did you want Shimon? You said.
I did.
Okay.
Yes, just one follow-up question. You mentioned that there were 150 facilities with evacuated patients, and 15 of them are hospitals. How many nursing homes patients were involved in? And there's always the issue of transfer trauma in transfer of an evacuation. How many, what are you doing to kind of anticipate that trauma on those individuals?
Well, to answer your how many question first, nursing homes that have been evacuated, at least, again, most recent information I have, 40, ALFs 91, the number of nursing home residents 3,508, number of ALF residents 3,012, and that's the most recent information I have as of probably 10 o'clock or so this morning, remembering that the facilities are self-reporting into our health facility reporting system. Now, to answer your other question, the Agency for Healthcare Administration has many partners involved in the effort to move patients when they need to be moved. Not only do the facility staff have a role to play, but all of the associations that I mentioned earlier, right? So the Hospital Association, Healthcare Association, Leading Age, all of those individuals are directly, they directly work with their member facilities, so nursing homes and ALFs. So it's a coordinated effort to make sure that the individuals can be placed in the right location for them, keeping in mind their health needs. Our health facility reporting system is also used to find where there are vacancies in other facilities. Many of these nursing homes in particular, have sister facilities elsewhere in the state. So it makes that kind of transfer a lot easier and less stressful on the individuals who have to change their environment.
So we'll have another update in another few hours. I'll just say it seems like over the last 12 to 24 hours, every time you look at this storm, it's just been bad news. It gets stronger, it gets larger, and we really appreciate people's concern for Florida. We do appreciate the prayers. I'm going to be saying prayers that the folks there are able to get through this as best as humanly possible. This is a really, really significant storm. It will be one of the storms people always remember when they think about Southwest Florida. Probably be the big one that they always remember. And if you know anything about our state, you go to Panama City, that Michael is just part of the DNA of the community. Homestead, Hurricane Andrew is just part of the DNA of the community. This Ian is going to rank up there with that. So we need the thoughts and prayers over the near term, and then there's going to be a huge effort on the back end to help people and to get the communities back on their feet. Thank you.